Now know drugs like Ozempic have changed the weight loss game. It's easy to forget that they were originally actually meant to treat diabetes. But now we're learning they can be saving lives in a whole new way. There was a new 3-year study apparently shows a similar class of drugs called semaglutides are working wonders for type 2 diabetes patients. The study found patients who get weekly injections show a 24% drop in kidney disease issues. Their risk of death dropped by 20%, and they had 18% fewer heart attacks and heart issues. Dr. Jorge Rodriguez is an internist and gastroenterology specialist who has prescribed these drugs. He joins me live now. Dr. Rodriguez, thank you for being with me.
My
For a
pleasure.
while I was thinking, gosh, are these drugs just like too good to be true? All these people are losing weight. It makes it look so easy. But now it makes you wonder, like, is this actually a wonder drug now that we've got this new study out?
Well, I wouldn't call them wonder drugs, but they definitely are revolutionizing how diabetes is being treated. We need to remember, first of all, that this study was done on diabetics. So we can't extrapolate and say, hey, these results are going to be are going to be the same for people that are using Wegovy, Ozempic for weight loss. And one of the major side effects of having diabetes long term is that it does damage the kidneys. That sugar that's floating around keeps floating and damaging those very small arteries that are the kidneys. So the fact that this medication has shown to actually change the cause of death in many people that have diabetes, actually, it is a wonder.
Yeah, I didn't realize. I was reading the stats, Doc. 1 in 3 people with diabetes also have chronic kidney disease. So it's very, very common. Is this the
Right.
kind of drug that, everyone with diabetes should try to get on?
Well, you have to take this with a grain of salt. The study also said, at the end that all of these other people were also on other medications, including Ozempic. Now, there was an
Mm.
arm where they didn't have Ozempic at all. So the question is going to be, where does this fit in sort of the quiver, of what we use, of the arrows that we use to treat diabetes? Because right now, Ozempic and this type of medication is not the first line of medications. We start with different ones. And then somewhere down the line, if things don't work, we put on Ozempic. Now, the question is, are we going to start using this earlier because we know it has greater benefits?
In terms of the weight loss issue, Doc, what do you think about using Ozempic for weight loss? Because I know all these people, they need to lose 10, 15 pounds. And instead of doing it the hard way, and I'm not talking like really obese people, I'm just talking people that like have a belly or whatever. And instead of, exercising, they go and they get Ozempic and they lose all this weight. And sometimes they get so skinny, it's almost freaky. Like they don't eat, they get too skinny.
Yeah,
What do you think about it for weight loss in those situations?
all right. Well, first of all, the branding of Ozempic for weight loss is called Wegovy. It's neither here nor there because it's the same thing. And I think that what you are alluding to is correct. I think there is a lot of abuse of this drug for people that have minor amount of weight gain, a little bit overweight. The actual recommendations for this type of medication for weight loss is people have to have a BMI, which is a basal mass index of greater than 27. Your doctor can tell you what that means. And you have to have at least one or two criteria for heart disease. So I agree with you. And I think it's overused in a certain segment of the population. We don't know the long-term side effects of this. A lot of people that have been on it, you're right, they look disfigured. And we know that these medications lose certain muscle that you're not going to regain. So yeah, you end up, a lot of
Mm.
people end up looking freaky. And it's hard to tell them that because they're so into the fact that they've lost weight. So this is a double-edged sword. I mean, I think I talked to Chris about this a couple of years ago, and the fact that we don't know the long-term side effects. The original studies were just like a year, in length. So be careful, with anything that is a wonder drug.
Yeah, it's good advice. And the Ozempic face, I mean, it's real. You see some of these celebrities, even people that I know. I mean, I think they either take too much or just lose a little bit of weight, but they get that Ozempic face. They look so freaky. So it's good advice. We don't know exactly how it'll all pan out. Dr. Jorge Rodriguez, thank you so much for coming on. I hope you have a good holiday weekend.
Hey, thank you for watching. Please go to newsnationnow.com, newsnationnow.com, And you can find NewsNation on your television provider. And don't forget to click the red subscribe button down below. Then you will get more of NewsNation's fact-driven coverage.